Hip and knee pain are among the most common causes of disability and limited mobility in adults over the age of 50. In the United States, more than 32 million adults live with osteoarthritis, the degenerative joint disease that most often affects these two critical joints. The problem is not simply discomfort, it directly impacts independence, balance, and quality of life. As people age, natural wear and tear of the cartilage, combined with reduced muscle strength and slower tissue repair, lead to stiffness and pain during everyday movements. Many older adults notice that activities once effortless, walking upstairs, standing from a chair, or even getting out of bed, become painful challenges. Fortunately, with modern medical understanding and proactive lifestyle changes, joint pain can be effectively managed and often significantly reduced. This article will explore the scientific causes, early warning signs, and the evidence-based strategies, including exercise, nutrition, and medical treatments, that can help older adults regain comfort and mobility. Degenerative changes and osteoarthritis. The most frequent cause of hip and knee pain after age 50 is osteoarthritis, OA. This condition occurs when the smooth cartilage that cushions the ends of bones begins to thin and break down. Without this natural shock absorber, bones rub directly against each other, causing inflammation, pain, and stiffness. Microscopic cracks in the cartilage trigger inflammatory chemicals, cytokines, and prostaglandins that further damage tissue, creating a self-perpetuating cycle of pain. Several risk factors accelerate OA progression: aging, genetic predisposition, prior joint injury, obesity, and repetitive physical stress. While cartilage loss cannot be fully reversed, consistent management can slow its degeneration and protect remaining joint tissue. Muscular weakness and imbalance. The hips and knees function as a kinetic chain, meaning their health depends heavily on the strength of surrounding muscles. When the quadriceps, hamstrings, and gluteal muscles weaken, the joints lose stability. Weak muscles fail to absorb impact during movement, transferring excessive pressure to bone and cartilage. This imbalance can cause pain on one side of the joint, leading to altered gait patterns, which in turn accelerate joint wear. Strengthening these muscles is therefore one of the most important steps in both prevention and recovery. Sedentary lifestyle and poor circulation. Modern lifestyles promote long periods of sitting. Reduced physical activity diminishes joint lubrication, synovial fluid, leading to dryness and stiffness. Over time, limited motion causes joint capsules to tighten and blood flow to decrease, which slows healing. A sedentary lifestyle also contributes to obesity and insulin resistance, both of which are linked to chronic inflammation, a known aggravator of joint degeneration. Excess body weight. Each additional pound of body weight places approximately 4 pounds of mechanical stress on the knees during walking, and nearly 6 pounds when climbing stairs. This cumulative force accelerates cartilage breakdown and increases inflammation. Clinical research from the Arthritis Foundation shows that losing even 10% of body weight can reduce knee pain by up to 50% in overweight adults with osteoarthritis. Weight management, therefore, is not only cosmetic, it's therapeutic. Prior injury and biomechanical misalignment. Past sports injuries, fractures, or joint surgeries can alter natural biomechanics. Even slight differences in leg length, hip rotation, or walking pattern can create uneven stress distribution. Over years, these small mechanical imbalances contribute to chronic joint inflammation. Recognizing early warning signs. Early recognition of joint deterioration is vital. The initial signs are often subtle: a mild stiffness after rest, slight swelling after long walks, or a dull ache at the end of the day. These are not just signs of getting older. They are early indicators of degenerative joint changes. Common symptoms include persistent stiffness, especially in the morning or after inactivity, pain that worsens with weight-bearing or climbing stairs, swelling or warmth around the joint, clicking, popping, or grinding sensation during movement, occasional instability, a feeling that the joint may give way, reduced flexibility and difficulty performing daily activities. Ignoring these signs often leads to irreversible cartilage loss. A thorough evaluation by a physician, including X-ray or MRI imaging, can identify structural changes and guide treatment before major damage occurs. The 5 golden strategies for managing hip and knee pain: keep moving. But Move Smart movement maintains joint health through a mechanism called synovial fluid exchange. Gentle motion delivers oxygen and nutrients to the cartilage while removing metabolic waste. However, not all exercise is beneficial. High-impact activities, such as running or jumping, can worsen joint damage. Recommended activities for older adults include walking, enhances blood flow and maintains joint range of motion. Start with 10 to 15 minutes daily and progress gradually. Swimming or water. Aerobics. Buoyancy in water supports body weight, allowing joint movement without compression. Cycling. Strengthens thigh muscles while minimizing impact. Tai Chi or gentle yoga improves balance, flexibility, and neuromuscular control. Clinical trials show that adults who engage in at least 150 minutes of low-impact activity per week report significant pain reduction and improved mobility. Strengthen. Supporting muscles. Strong muscles act as scaffolding for the joints. A comprehensive strengthening plan should target quadriceps, front thigh, stabilize the knee and absorb shock. Gluteal muscles, hips, support pelvic alignment and walking mechanics. Hamstrings, back thigh, assist in knee flexion and balance. Core muscles, reduce compensatory stress on hips and knees. Sample exercises: seated leg raises, wall sits for 20 to 30 seconds, glute bridges, lying on your back, step-ups on low platforms. When performed consistently, 2-3 times weekly, strength training reduces pain severity, prevents falls, and improves overall joint function. Always consult a physical therapist to ensure arms proper form and progression. Manage weight and reduce inflammation through nutrition. Diet plays a powerful role in joint health. Chronic inflammation is both a cause and a result of arthritis progression. Adopting an anti-inflammatory dietary pattern, such as the Mediterranean diet, can alleviate pain and improve long-term outcomes. Key recommendations: increase fatty fish, salmon, sardines, olive oil, nuts, seeds, whole grains, and colorful vegetables. Reduce processed meats, sugary foods, refined carbohydrates, and trans fats. Add turmeric and ginger for their natural anti-inflammatory compounds. curcumin, and gingerol. Adequate hydration, 6 to 8 glasses of water per day, helps maintain synovial fluid viscosity. Additionally, vitamin D, calcium, and magnesium are essential for bone and muscle strength, especially in older adults. Use smart tools and home modifications. Environmental adjustments can make everyday life easier and prevent pain flare-ups. Supportive footwear reduces shock on knees and hips. Replace old shoes regularly and use orthopedic insoles if necessary. At home, use the ergonomic chairs with firm seats and proper back support. Install grab bars in bathrooms and non-slip mats to prevent falls. Alternate between sitting and standing every 30-40 minutes. Use heat therapy for morning stiffness and ice for post-activity swelling. Simple tools like adjustable walking canes, knee braces, or compression sleeves can temporarily offload stress during flare-ups, but they should complement, not replace, active therapy. Medical and alternative therapies. For moderate to severe pain, medical interventions may be necessary. Physical therapy is the gold standard, combining manual manipulation, tailored exercise, and education. Other medical treatments include corticosteroid injections, rapid relief from inflammation, but limited to a few times per year. Hyaluronic acid injections restore lubrication and cushioning within the joint. Platelet-rich plasma, PRP therapy, uses growth factors from your own blood to promote healing. Surgical options, such as arthroscopy, osteotomy, or total joint replacement, are reserved for advanced cases when conservative management fails. These procedures, now minimally invasive, can restore mobility and quality of life. Complementary methods, such as acupuncture, massage therapy, or gentle chiropractic care, may further relieve muscle tension and improve circulation. Lifestyle, mindset, and long-term joint care. Posture and daily movement habits. Maintaining proper posture reduces chronic strain. Poor posture compresses the hips and knees, accelerating wear. When sitting, keep both feet flat and avoid crossing legs. When lifting, bend the knee and engage the core. During walking, maintain a tall, balanced posture, shoulders relaxed, gaze forward. Regular micro breaks during sedentary activities, like TV or computer work, improve blood flow and joint lubrication. Recovery and sleep. Joint repair occurs primarily during deep sleep. Insufficient rest increases pain sensitivity and slows tissue regeneration. Adults over 50 should aim for 7 to 8 hours of quality sleep per night. Before bedtime, light stretching or a warm shower can ease stiffness. A supportive mattress and proper pillow alignment also prevent joint discomfort. Mental health and social connection. Chronic pain is not only physical. Studies reveal strong links between joint pain and depression, as reduced mobility can lead to isolation. Maintaining social connections, group exercise, gardening clubs, or volunteering promotes mental resilience and reduces perceived pain intensity by up to 30%. Mind-body practices, such as meditation, deep breathing, or guided relaxation, also lower cortisol levels and inflammation. Positive mindset and self-efficacy. Believing in one's ability to improve is a therapeutic factor. Fear of movement, kinesiophobia, often causes further stiffness and decline. Reframing movement as safe and healing changes the brain's pain response. Patients who adopt active coping strategies demonstrate better recovery and less dependency on pain medication. When to seek professional help. Prompt medical evaluation is essential if you experience persistent pain lasting longer than 2 to 3 weeks, swelling, redness, or warmth around the joint. Severe limitation in movement or walking, pain that disturbs sleep, fever, or unexplained weight loss, possible infection or systemic disease. An orthopedic specialist may recommend imaging, lab tests, or joint aspiration to determine underlying causes. Early diagnosis often prevents irreversible cartilage damage and may allow non-surgical management. The hips and knees are not just joints. They are the pillars of independence. Through consistent care, physical activity, balanced nutrition, posture correction, and timely medical attention, older adults can preserve mobility well into later decades of life. The journey toward pain-free living begins with awareness and daily discipline. Each step you take with care is an investment in freedom, vitality, and dignity.